How does mitochondrial dysfunction affect CFS-ME patients? Imagine your body's energy factories suddenly not working as they should. That's what happens in people with chronic fatigue syndrome and myalgic encephalomyelitis, where the cells struggle to produce enough energy. Mitochondria are tiny structures inside cells that generate the energy our bodies need to function. When these mitochondria don't work properly, it can cause a cascade of symptoms that make everyday life challenging. Research shows that in CFS and ME, mitochondria often have reduced ability to produce energy efficiently. This means cells generate less adenosine triphosphate, the molecule that fuels most cellular activities. When energy production drops, muscles feel weak and tired, even after minimal activity. Patients often experience post-exertional malaise, where symptoms worsen after physical or mental exertion because their cells cannot keep up with increased energy demands. Biopsies of muscle tissue from people with CFS-ME reveal mitochondrial damage, such as structural degeneration and deletions in mitochondrial DNA. These changes are linked to how severe the fatigue and other symptoms are. Immune cells also show signs of mitochondrial impairment, which may contribute to immune system dysregulation seen in the illness. This can lead to increased susceptibility to infections and difficulty fighting off viruses. Oxidative stress, which involves damage from harmful molecules called free radicals, is higher in CFS-ME patients. Mitochondria are both a source and target of oxidative stress, and this damage can further impair their function. Some viral infections, like human herpes virus 6, have been associated with mitochondrial issues, suggesting that infections might trigger or worsen mitochondrial problems. The energy deficit caused by mitochondrial dysfunction affects many parts of the body. It can lead to problems like orthostatic intolerance, where blood flow regulation is disrupted, and heightened sensitivities to light, sound, or chemicals. This widespread impact explains the broad range of symptoms patients experience, from brain fog to muscle pain. Understanding the role of mitochondria in CFS and ME helps guide research toward potential treatments that might support mitochondrial health. However, current medical consensus emphasizes that mitochondrial dysfunction is just one piece of a complex puzzle involving immune, neurological, and metabolic factors. There are no approved treatments specifically targeting mitochondria yet, so managing symptoms with personalized medical advice remains essential. In summary, when mitochondria don't produce enough energy, it leads to the profound fatigue and systemic issues characteristic of CFS and ME. The evidence from biochemical studies, genetic analysis, and clinical observations strongly supports mitochondrial dysfunction as a key factor in this condition. But because each person's experience can differ, it's important to work with healthcare professionals to develop an individualized approach to care.